for this episode of our Decoding AI in Healthcare series. Today, we are diving deep into balancing innovation and safety, a framework for AI in healthcare, a conversation that could not be more timely as AI reshapes our industry. And leading this conversation is Imran Qureshi, a visionary technology leader and chief AI officer at b.well Connected Health in USA. Imran is at the forefront of healthcare interoperability with over 10 patents and groundbreaking work on FHIR technology. His innovations from real-time data streaming to advanced consent management are redefining how we securely exchange and use health data at scale. So get ready to hear from someone who is truly shaping the future of AI in healthcare. And welcome, Imran, to this show. We
Nice
have
to
our
be here.
host, yes, we have our host, Dr. Amit Kumar De, founder chairs of DoctorsAI, a global community of global medical community of 2,000 plus professionals passionate about AI in healthcare. So, Dr. De, it is such a pleasure to have you back to our show. And joining him is our co-host, Dr. Dipu Patel, a dynamic digital healthcare consultant and educator who champions technology's role in transforming patient care and medical education. So welcome, Deepu. It is such a pleasure to have you again.
Thank you, Hitvi. Thank you for hosting. Welcome, Imran and Amit. It's great to
Recording
reconnect.
in progress.
Absolutely. It's always great to be back on the podcast. A warm welcome to all our viewers, all our friends, and a warm welcome to Imran. And just a kind of peek back into this podcast. We've been doing this for over a year and a half, and we had some fantastic discussions on ethical, effective, responsible use of artificial intelligence in healthcare with a good number of viewpoint leaders across the globe who shared their thought process in this particular podcast. So once again, a warm welcome to Imran. And dear friends, today we're gonna sit with Imran and we're gonna brainstorm on a very important and a very interesting point about how we can scale innovation and still make it sustainable and make sure that there is safety all around. In Doctors AI, there is something that we strongly believe in now that AI in healthcare is evolving. We believe that it has to be responsible, it has to be transparent, and it has to be real. And now also we are believing in the fact that there should be ambient AI so that it seamlessly merges into the workflow of every clinician without increasing their burnout. So for doing all this, it's not an easy task, and we need some brilliant minds from the technology world. We need people like Imran collaborating with us, building solutions hand in hand, understanding the need gap that we clinicians bring from the front line, putting the data to work, putting more information on the data, and then adding that intelligent layer on the data. But with that, at every point, we must make sure that we are following the guardrails, we are ensuring the safety, we are maintaining the ethical standards amongst this entire spectrum of innovation that artificial intelligence brings in the field of healthcare. So to talk about that, we have Imran joining us today, and of course, my brilliant co-host, Dipu Patel, the ever-smiling person. I will just hand over to Dipu to take this forward. I'll take a back seat, listen to this, but I'll come in at the end with my comments. Over to you.
Excellent. Thanks, Amit. Again, welcome, Imran. So we've given you a pretty long list of things that you need to do right away for us because, us healthcare providers are very demanding of what we want and what we need. And you're not new to this. You've been doing this for many, many years. But I'd like to start off by something you've spoken on pretty frequently, which is the importance of frameworks in AI in healthcare, akin to physician or health professional training. So what does a good AI framework look like to you, and how do we balance that safety and innovation that we all strive for in our lives?
Yeah, I think great question, Dipu. So the way I think about this is, let's first put the technology aside and just think about from a people standpoint, what are we talking about? So if you think about in healthcare, whenever we're trying to make decisions, we are using a few principles in healthcare when we make decisions. So first is, of course, the Hippocratic Oath, which is we want to avoid doing harm. And realistically, what we want to do is we're just balancing the risk of doing harm to the benefit to the patient if we intervene. And we're not in any situation where we cannot completely remove the harm that we could potentially do. Every medication has side effects, every treatment has side effects. But we're really weighing on the side of making sure that we are focused a lot on reducing the risk of harm versus the benefit that we can provide to the patient when we intervene. So I think the same principle applies in AI. We do not want to say that we will not use AI because it has a potential of doing harm, just like every treatment we do in healthcare has a potential. But we want to make sure that we are making the intentional choices to say we are using AI when we feel that the risk of doing harm is much lower than the benefit that we can provide to the patient. So that I think is the first principle we want to start with. Second is, as we think about how do we make decisions in healthcare, there's a few principles we follow. One is we go to the expert in that area to help us make that decision. Right? It would be unheard of to have a pediatrician make a decision about the stage of cancer in a patient, right? That is not the area of expertise. So how do we use AI to really hone in on a curated set of resources that have been created by experts in that area when we're trying to make a decision in that area? For example, if you go out on the internet and you ask people whether you should get a vaccine or not, I think we would all agree that we would not trust that answer. I think we would trust the answer that comes out of Center for Disease Control or some authority that focuses on researching it. So I think that is a really fundamental principle, is to curate our resources that we're using to answer an AI question based on a curated set that comes from the experts. The other principle I think we think about is like the principle of second opinion in healthcare. Right? So whenever we're making a hard decision, we like to have a second opinion because no one person has all the information, has seen all the best practices. So one of the things we do in AI is really use that same principle to say, can we use different ways of asking the question and different AI models to answer the question, and to then see if the answers converge, if they're all answering the same thing, or if they don't. And so if you think about it in healthcare, what happens is if you go and get two opinions and those opinions happen to be the same, then you say that's probably right, let's move forward. If those two opinions differ, if one person says this cancer looks malignant and the other person says they look benign, then what is the next step we take in healthcare? We do a set of tests, right? We basically validate this more to get that. And so that's also, I think, another principle in AI we use is like, how do we figure out if the answers are not the same when we ask the question of different AI models? Then how do we create that validation loop to figure out which is the answer that is the correct answer? So those are some of the key principles that actually, I think, just follow from what we've always done in healthcare for hundreds of years, but really applying it to AI in the same way that we're all used to in healthcare.
So, what I'm hearing through the three things that you've identified is human, human, human. And I think that is the most important part of any framework that we would be looking to build, whether it's healthcare or any other industry, but especially in healthcare, the human in the loop component of the work that is happening in this space is so important and cannot be forgotten in any aspect of whether it's planning or implementing or scaling, wherever you are in that. And the human being is really the voice that will say go, no go, kind of a thing. So would you agree with that part of it? The human part of it is really important.
Yeah, I think I would agree, but I would probably go. So I will use the example of internet, right? I think we are very familiar with when the internet came out. So I remember when Google search first came out. Right. And so we were all used to Yahoo search. So that's basically you would type in the name of a category and it would take you to a lot of websites that were from that category. So if you wanted to buy a bicycle, you would type in bicycle and you would see a bunch of websites that had bicycle and you would click on all of them to try to find the bicycle. Right. When Google first came out, we were all typing one word into Google search. So
Yep.
people would go into Google search and they would type in bicycle, right?
Mhm.
And then they would get results, and those results were really no better than the results you would get in Yahoo. It took us some time to realize that to use Google search, we can actually type in a full sentence of what we're looking for.
Mhm.
So we can say, I'm looking for a red bicycle that's between $200 and $300, and that is, a road bike. And then the answers that Google search would give us were actually very useful and would save us a lot of time. So I think that the lesson to learn there is that human in the loop is really important, but that we humans also have to change, just like AI changes with us, right? So just like in the Google search example, we humans learned that using Google search required us to work differently than we did before. I think that's a key principle in using AI, just like any technology, is like we as humans in healthcare have to say, we have to work differently. And an example of that is one thing that we have learned using AI is actually different than Google search. So in
Right.
Google search, you ask a very specific question and you try to get that answer. So for example, in Google search, you may ask, is there luggage storage in the Amsterdam train station?
Mhm.
What we find is AI is actually different. So in AI, what you do is you define your goal as a human. You say, I am traveling in the Netherlands. I will spend 1 week in Amsterdam. I'll spend another week, traveling the countryside. I don't want to carry my luggage when I'm traveling the countryside, but I will need my luggage when I'm in Amsterdam. And then AI actually gives us the answer that we're looking for. So as we think about healthcare, I think one thing that one of my doctor friends told me that I think really stuck with me is they said that the role of the clinician changes in AI. It goes from being an oracle of knowledge to being a Sherpa. And what that means is, as humans in healthcare, instead of us saying patients are coming to us and our goal is to provide them all this knowledge, today patients can get that knowledge from various mechanisms. Our goal is to help them make the right decisions as a Sherpa using all this knowledge. And so how do we change as humans to work with AI? And in the same time, AI, just like Google search, learned what people were doing and started to predict what people were actually wanting, is AI will also get better with us. It will also evolve with us. And it will actually start to understand us much better as to what we're asking. And the convergence of both things, humans starting to learn how to work with AI best, and AI also learning what humans are doing, are really going to get us to a point where humans are in the loop, but we're also successful with AI rather than it being, a simple question answer.
Yeah, and one of the things that we, at DoctorsAI, and Amit and I have had several conversations on this podcast and outside about how it really is a co-creating and a co-designing of what that experience looks like for us as healthcare providers. And while our work, while what we do as healthcare providers, which is caring for patients, isn't going to change, that crux of it isn't going to change. How we do that is the thing that's going to change. And that's what AI is going to help us do, which makes what the next step of what, as we think forward, and things that you are doing at b.well is really trying to figure out that balance of human AI collaboration and bringing it forward into the clinic, into the hospital, that is patient facing, but also provider centric, right? Really leveraging these tools to help clinicians make better informed decisions. You're right. We went to school for this training. We have all this training and knowledge that we have, but we don't impart every single morsel of knowledge to the patient. It really is very patient dependent on what they're there for, what we're seeing them for, what are their diseases or what their disease processes are. And those really inform us. But AI can say, patients kind of have the basic understanding of that knowledge because knowledge is now available pretty freely, I would say, across the globe. Our job is to make sense of the knowledge, and that's the shifting that's happening in healthcare. So
exactly.
That leads me to the next question, which is, how do you think we can apply lessons from medical education and clinical oversight to the training and monitoring of AI systems in healthcare?
Yeah, I think kind of what the points I were making earlier is I think AI, while it is different, is no different.
Yes, it is so true. I think we give AI a lot of credit.
Yeah. Yeah, and I think, like the statements I hear from other healthcare workers is, wow, AI is so intelligent.
Right.
And it makes me feel dumb. And AI at the end of it is really a collection of the wisdom of humans. Right. AI has been trained on the internet, on publications we have. And so it's in a way, it's sort of like taking a poll of all the experts in an area and giving an answer. I don't think we would say the pollster is intelligent. We would just say the pollster has done a good job of collecting the wisdom of all the experts in that area. So I
Excellent.
think that's the
Excellent.
correct way to think about AI, is that it's not that AI is intelligent. AI is just efficient at collecting the wisdom of the experts in that area. So
That's
every answer it gives, it's not making up an answer. It is actually combining the answers it has found from the experts online into the best answer. So that is what AI is actually doing. So I think if we think about that and we say, okay, so we already have processes in healthcare today to do that, right? We have, when papers get published, they go through a peer review, and then they come out and we can say, okay, the experts in that area have signed off on this paper saying this paper seems to have followed the right processes and we can trust its judgments. Similarly, when a patient has a condition, we consult with an expert in that area. If a patient has cancer, we would consult with an oncologist, and we would say, you clearly have a lot more experience in this area, so let me get the wisdom of what you have learned. So I think we have to think about AI in exactly the same way. It is not intelligent. I almost wish that we didn't call it artificial intelligence.
I would agree with
to
you
begin.
there. I think it's such a misnomer, and it
Exactly.
really confuses us.
Yeah. Yeah, and I think the harm it causes, it makes us think that this is not related to humans, like this is not human knowledge, and that creates this artificial barrier. We think that this is not the knowledge of doctors. We think this is not the knowledge of researchers. We think that this is AI's knowledge, and so as a result, we are affront to it. We resist it. But if we just think about it, that this is just a collection of the knowledge of doctors and researchers in this area, then I think we will see our attitude be a lot more open to it. So I think in terms of the processes, I think we can apply a lot of the same processes we already have in healthcare for any kind of knowledge, whether we get it from a research paper, whether we get it from a clinical guideline, is that we go through those same steps. We verify the authenticity of it. We verify whether it is from experts that know that area. And then we do a few validation tests to say, does this actually apply in my condition? For example, if a new treatment comes out, we don't just prescribe it to everyone. We would sort of test this with some people. We would say, okay, let's try this and see if it's actually working. And if we see the signs are good, the example would be GLP-1, right? I don't think any doctor would just prescribe GLP-1 to everyone. They would say the experts are saying that it works in these cases, and these are the adverse events to be watching out for. They would then test this with some of their patients and see if they're seeing the results that are same as what they're reading in the clinical guidelines. And if so, then they will continue doing it. If not, they will say that their population tends to be different than what the research was done on, and so they're not really going to take and apply it. So I think the same principles apply in AI. Is we want to make sure that we are listening to the experts. We're curating the content of our AI not to be the internet, but to be sources that are trustworthy. How are we using the second opinion concept to make sure that we are finding out if the experts tend to agree, if different AI models tend to agree on the answer? And then how do we validate that through some tests to make sure that this is actually applying to our population rather than a completely different population than the population we're dealing with right now?
Right. And I think this is the part where this is the area that I do think AI is very powerful, because we, up until recently, with AI and the large data sets we have now, to really do some of the modeling and predictive modeling using AI data sets, which allows us to perhaps make better hypotheses as these trials.
Yeah.
I don't think we will ever completely replace human randomized controlled trials, but I think we will make better informed decisions when deploying randomized controlled trials in humans, because AI is going to have that extra added layer of data pointing to potential adverse effects and whatnot. So
yeah,
go ahead.
Yeah, I think the other thing I wanted to kind of mention is that I think we have to think of health AI, not healthcare AI.
True.
So if you think about the average person, they spend about 12 hours in front of a provider, whether it's a doctor or a pharmacy or a lab or a nurse or any of these sources. That's 12 hours in a 365-day year.
Right.
And so while it is clearly important for us to optimize those 12 hours, we also have to say, I think a bigger benefit is how do we optimize the whole 365 days? And a couple of examples to kind of make it real is, about 40% of people do not do their recommended labs before they show up for a visit, right? When
I
people
thought that
leave,
number would be higher, Imran, actually.
Yeah.
That's pretty good, actually.
But think about it, like if you're
true.
a doctor and the patient shows up and they haven't done their recommended lab test, the most likely thing you're going to do is send them back to get their lab test done.
Yeah,
and so you actually wasted.
Decisions.
Yeah,
right.
Exactly. The other statistic that is, a couple other statistics that are very interesting is, when the doctor writes a prescription, a third of those prescriptions are never picked up.
Yep.
So that means, if you see 3 patients and you write 3 prescriptions, one of them isn't even going to take it. Right. So, and then also, if you look at care plans and discharge instructions, 70% of care plans and discharge instructions are not properly followed. Mm-hmm. So I think while there's clearly use for using AI to optimize those 12 hours that a patient is spending in front of a care provider, I think it is about how do we extend the reach of the providers to the whole 365 days using AI? How can we make sure they do the lab test before they show up? How do we make sure that they have summarized all their information, including medications they're taking, all this stuff before they show up? How can we make sure that they have the right questions to ask us when they come to see us? How do we ensure that when they walk away from us, they will pick up the prescription, they will follow the care plan, they will follow the discharge instructions? So that's when we at b.well really think about it as that's health AI. That's the 365 days of the year. That's that's together with healthcare AI, which is really the 12 hours a year that you're spending in front of a clinician.
I love that distinction. And actually, that brings me to the next question I have, which is that at b.well, you are supporting enterprise scale AI solutions for clients like Walgreens and Samsung. What are some of the key technical or human factors that make or break an AI adoption at scale? I think you're starting to hint at some of them, and it's really exciting.
Yeah, I think it's that health AI point again, right? So healthcare AI, it's sort of interesting if you think about there are 3 main areas in which AI is being deployed in healthcare. Right, so the first is around documentation, right? AI scribes and things like that. And while that is important, statistics are showing that doctors are not seeing any more patients, whether they have AI scribes or not. It helps them with some time management. And they're not really seeing any improvement in outcomes and things like that. So it's a helpful aid, but it is not fundamentally changing how healthcare is done. The second area where we see AI deployed a lot in healthcare is in the help with diagnosis part. Mm-hmm. And while that is really helpful in some percentage, but the reality is 90% of diagnoses in healthcare are considered simple or moderate, meaning that they are pretty easy to diagnose. There's probably 5 to 10% that are complicated. And the third area where AI in healthcare is being deployed is back-end automation. And how do the providers bill using AI so they get paid more, while payers are deploying it to reduce reimbursement using AI. So it's essentially both sides are deploying AI, and we would expect that they end up back at the same place, right? Because each side is deploying it exactly.
Right.
So I think we have to ask the question is, is the problem in health actually in healthcare, or is it in health?
Mm.
And I would make the argument that I think our bigger problem is in health for some of the reasons that I mentioned before, like lab
Mhm.
tests aren't being done, people aren't making the appointments, they're not seeking the care that they need, and they're
Mhm.
not following through on treatment and prescriptions and adherence that is after the thing. So I think where we're really seeing a lot of value is applying AI, outside of healthcare. Is we believe that's where the bigger problem exists, and getting patients, going back to the example of the doctors not being oracles of knowledge anymore, but being Sherpas, is
Mhm.
how can we make patients do the right things so that when they come for their health care, they are prepared, they've done the things that they need to done. So the job of the clinician becomes much easier because they have all the information at their fingertips, and they just do what they're really good at, which is, determine treatment, diagnose and determine treatment. And then when the patient walks away, we use AI to make sure that the doctor's instructions are being followed and the patient is doing the things that they need to do. So we're
Yeah.
seeing a lot of interest in that. The last point I'll make there is, I think it's going to take some time for doctors and nurses to come around to using AI.
Yeah.
And that's because of, you mentioned the fact, training. So, when doctors and nurses go through training, there really isn't a class on AI or technology. Right? They learn about medicine, and they learn about patients, and they learn about, diagnoses and treatments. So I think it's going to be it's going to take time for doctors and nurses to learn how to use AI.
Mhm.
On the other hand, as patients, as consumers in our real world, we deal with AI all the time. Like whenever you're using
Yeah.
Facebook or Instagram or WhatsApp, there's AI underneath that is
Yes.
been doing stuff. So we as patients and consumers have been very used to AI. Our car has AI, right? All our cars have AI. So what we're finding is that the patients are very used to AI, and because they don't really have the medical knowledge anyway, even very basic AI is very useful to them,
Right.
because something that tells them the difference between cold and flu is incredibly useful to the average person. It is pretty much useless to a doctor because they already know the difference, right? They don't need AI to tell them the difference between cold and flu. So we think really applying it to health AI is going to actually help the jobs of clinicians, because patients are going to be more prepared. The information is going to be at their fingertips. They can focus on diagnosis and treatment, and then AI will take over and make sure that the patients are actually following through on those.
And I think you're speaking to something that even that I have experienced in seeing patients is patients are really driving adoption when it comes to AI, whether to your
Yeah,
point, whether they know it or not, they're using it in their daily lives.
yeah,
But those who are even at a very basic level informed about AI do come in with a list of questions. And I looked it
yeah,
up on, ChatGPT, and
yeah,
this is what it told me, right? And
yeah,
so the to put a finer point in that is that we as clinicians need to be prepared. This is I akin it to the Google search or the internet search when the internet first came out, right? I Googled my symptoms. I have cancer, which is what it always tells you. And, don't
yeah,
believe it. But
yeah,
there may be a little bit more truth to what ChatGPT tells you, but that also doesn't negate the value of the conversation that you get to have with that patient when they come in
exactly.
with the list of concerns that they have. Because to your point, we may be the oracle of knowledge, but we need to be the Sherpa to really
Yeah,
help parse out, like, no, your sore throat isn't cancer. It's
yeah,
probably the flu, right? And
yeah,
so it just like any other approach to the use of technology, we have to learn how to navigate that with our patients, knowing that our patients are going to be driving a lot of the adoption. And I
yeah,
think that has been true for other technologies. And it's really amazing to me how slow we are as a profession to adopt to a lot of the technologies. Even CAT scans and MRIs took the better part of a decade to be adopted
yeah,
into use. So this one, AI,
yeah,
I mean, is going to be even a longer, I think, longer lag curve on adoption. So
Yeah, and
yeah, go ahead.
no, I was just going to make a comment on that. So I think you're absolutely right. I think part of it is attitude. So I think, as healthcare workers, when someone comes in with information through ChatGPT, I think instead of us saying you can't trust ChatGPT and all this stuff, the thing we should focus on is that this patient is actually engaged in their care. And that is probably the number one thing that determines the success of someone's treatment is how much are they engaged in their own care? How much are they going to follow through on the treatment? How much are they going to stick to it? How diligent are they going to be? And so I think as healthcare workers, we have to change our attitude to actually being encouraging and saying, oh, that's great. Now let me help you as a Sherpa sift through this knowledge. Yes, this thing happens, but not in people your age. So you don't have to worry about this being cancer because that is really small. That's 0.1%. And that happens in people who are 65 and above and who have a family history of this. You don't have to worry about that. This is likely more common. So let me have a discussion with you about that. So I think we have to just, first of all, recognize that it's actually great that they're engaged in care. And that is actually going to determine the success of their care much more than the fact that maybe they got some information wrong because they don't have the same training that healthcare workers do.
Or I think the question that I start with when they say that is what did you prompt? Like, because there's no way they've put in every single symptom they're having, including their family history or all of these other factors that go into the making of a clinical diagnosis. So you're absolutely right. I think it's meeting them where they and I agree. I think use of the technology points to at least some level of digital literacy, which is really, really important for both providers and patients. So that takes me to the next, I guess, point, which is as you are developing these AI solutions, what advice would you give to policymakers or innovators in low resource settings who are trying to leapfrog the AI-enabled healthcare? And I'll point to the more developing countries. The U.S. has a very robust kind of tech infrastructure, so to speak. Maybe one would argue too much regulation. But then you have developing countries who don't have regulation at all and are able to kind of leapfrog into implementation and scaling much faster than anything that's happening in the US. I see both ends of it. I see pros and cons to both sides of it. But there is caution on both ends of that spectrum for policymakers and innovators. So what would your advice be?
Yeah, I think this is actually a great opportunity for developing countries. So a similar thing happened when developing countries essentially skipped the desktop computer and went directly to mobile, right?
Yeah.
So
mobile.
and so if you go, if you travel in most developing countries, you will find that almost everyone has a mobile phone, and the mobile infrastructure is pretty good. And you look at desktops, and almost no one, unless you're an office worker, have a desktop. Lots of people don't even have desktops at home. Everything is mobile. So I think this is also a great opportunity because I look at it as, in the U.S. and the European and developed countries, there's a very good infrastructure for healthcare data, right? Healthcare data is all digitized in the U.S. and in Europe. In developing countries, it's still paper. Like if you go there, it's, you go to the lab and they give you a printout, right? And there is no digital version you can get. And you go to the doctor and they give you a visit summary and there's no digital thing. So I think we can use AI to actually leapfrog and say, maybe we don't need to wait for a digital data infrastructure to be built in these countries. We can actually jump directly from paper to AI. So I think that one is a really good principle because, going through the digital data step, it's taken us a long time in the US and in other developed countries, but we can leapfrog it. The other thing I think I would say is I think we have to differentiate the different uses of AI and use the appropriate regulation for each. So, for example, today, if there's an app that tells you about how to count your steps, we don't make that be a FDA medical device that has to go through all kinds of, validation, right? And so I think when we think of AI, we can separate that into the three buckets, right? One is where AI is actually doing the treatment. So these could be, insulin pumps and things like that. So they clearly need to go through a lot more validation because they are actually treating the patient. I think there's the second level, which is where AI is recommending treatment. I think that can have a lower set of regulation because there's going to be a human eventually who is going to prescribe the treatment. So we do have a validation step there. And third is where it's just giving you general advice to the patient. And these aren't really clinical recommendations. Like, if it tells you to walk more, I'm not sure any clinician is going to say this is going to, seriously harm you. So I think by having the 3-tier system of saying, let's apply the right regulation at the right category, we can protect ourselves in the use cases where AI is actually administering the treatment, which we have to be very careful of, and have it be very loose in areas where AI is really focused more on wellness and general health rather than clinical treatment. And so I think that way we can avoid this where we have either too tight regulations or we have very loose regulations on everything.
Yeah. Where would you say the radiology piece of it would go in that framework that the 3 steps that you just proposed?
Yeah, so I think if you look at the deployment of AI, radiology is clearly a favorable spot, but it has been different
far ahead of every other field that in terms of deployment. Yeah.
But what is really interesting is, we've been talking about for over a decade that AI will reduce the number of radiologists. Right. There's even Bill Gates said that a while ago. Right.
I disagree. I respectfully disagree, but okay.
And the data proves you out. So the number of radiologists now is actually more than it was 10 years ago. So I think that teaches us a lesson, which is that I don't think AI will generally reduce employment. What AI will do is it will essentially increase the effectiveness of all the people. And this is actually technology in general. There will always be small pockets of, where employment gets affected because those roles were not creating that much value to begin with. But largely what happens is technology improves the effectiveness of the people we have. So radiology is a great example, right? So if you think about what has happened in radiology, probably 10 years ago, radiologists were like really closely looking at the images, right? So that I think has kind of reduced because AI can, find small things in the image, where radiologists are focused now are on interpreting those things. They're not about finding the little dark spots. They're more about interpreting the dark spots. And so that I would argue is actually a better use of a human's time. I don't think evolution trained us to find little spots in things, but evolution trained us to interpret things, right? Because that's how we survived. Is we had to make quick decisions about what we saw around us, whether we were going to run or whether we were going to fight or whether it was a friend or foe. And that is something that humans are really, really good at. And so I think AI is going to enable the same thing across all of healthcare, is that we will start to spend less time on finding the dark spots. We will spend more time on interpreting what those dark spots mean.
Yeah. And I will say it is following this technology, AI, in this era that we're in, is following suit from a historic perspective of any technology that has been introduced into our culture, whether it be the Industrial Revolution, the automation of all of the things that we've been doing, and now this, right? There's always been a shift of manual to more thinking and knowledge level approaches. And you're right, there will be shifts, but I can't imagine them being so drastic, especially in healthcare, that we won't all have a role to play as we're deploying and using these tools at scale.
Yeah. And I think it's going to be good for everyone, because if you ask patients what is the number one thing they want from their doctor, all surveys clearly say the number one thing they want is they want their doctor to understand them, listen to their questions, and give them a personalized treatment. Yeah. And you ask the question of doctors, what is that you want most? And they want to have time with their patients so they can understand them.
They want the same thing,
right.
Exactly.
But it's not happening today. And so that's where I think the power of AI is, because I think right now healthcare is mired in sort of the administrative process, right? Whether it is getting the summary of what medications the patient is taking, whether it is about determining the right ICD-10 codes to put on a form, whether it is how do we have the right documentation for billing. That is where healthcare is spending its time, and it's pretty clear where both patients and doctors want to spend their time.
Right.
So I really think AI is actually going to enable that. So AI is actually going to get us back to actually what people actually want, which is I sit in front of the doctor knows everything about me. The doctor isn't spending all their time on administrative stuff. They're actually listening to me and listening to my concerns. And they're coming up with a personalized treatment plan that is going to work for me rather than a generic plan that is not going to fit my lifestyle or my culture or things like that.
Right, right. So as both a CTO and Chief AI Officer, how do you lead conversations internally about responsible AI development? And what questions do you wish that healthcare leaders were asking more? Because here, we've met with a lot of leaders and thought leaders on this podcast. But what are the questions that we should be asking that we're not as healthcare leaders?
Yeah, so I think it first starts with the point I was bringing earlier. We have to recognize that AI is actually not intelligent in itself. It is a combination of human intelligence. So I think first we have to start from that. And once you start from that, I think people calm down, because trying to say that there is a non-human intelligence doing something freaks everyone out. Right, and this is not just healthcare. If any a place you would say non-human intelligence was making decisions, you would get really, really concerned. But if instead you said that it's really collecting the intelligence of humans and is deploying it, the discussions become a lot better. Second is, I think we have to also adapt, and this is really, if you think about why has the human species survived compared to everything else, we are not the biggest. We're not the fastest, right? We're not the strongest. The reason human beings have evolved to be the dominant species on Earth is because we adapt really well. Yeah. We are very good at adapting.
Even though we hate it. We hate change.
Yeah. we hate change, but we do adapt it. And we adapt in ways that I don't think we knew in the beginning. So I would ask the audience a question. When you first saw the internet, did you predict what you would do with the internet?
Right.
I don't think anyone did.
Nope.
Right. No one predicted social media. No one predicted all these things. Right. And it's because these things naturally evolve as humans adapt to things. So I think the conversation I have with healthcare workers, doctors, executives, is that we have to look at AI in that manner. It is a collection of human wisdom, and we have to adapt. And we have to evolve it. So we don't have to sit here and worry about what it could become one day, because almost guaranteed it will not become what we predict, because we are never good at predicting things like this. We never predicted what the internet would become. There's even a video of Steve Jobs on YouTube, if you go watch it, when he introduced the iPhone.
I've seen it.
All the things, all the things he predicted did not turn out to be true. And we think of Steve Jobs as this visionary. We don't use the phone at all like Steve Jobs thought that we would use the phone. We actually the least thing we use the phone for is making phone calls nowadays. So I think it's really having that discussion is we are gonna adapt, and we are gonna evolve AI together as a human species, and it will become something that everything becomes, which is it will become largely good, but will also have bad things, because that's how humans are. If you look at every technology, everything we've done, it has largely been for the good, but it has had areas where it has been for the bad. That's the internet, that's the mobile phone, all of these kind of things. And the thing that I really see is, I see that in my kids. So I think this happens through generations. So I think there's this misperception that mobile phones have made our kids less social. Right? Social media has made our kids less social. I actually don't think that's true at all. Like, if you look at your kids, they're on their social media, on Discord, talking to their friends all over the world all the time. And even that they are using the Track My Phone to kind of watch where their friends are and making sure their friends are safe. Right? This is something that we never did growing up, but they have developed this new way of helping each other. So I think that's the lesson to learn, is like, we are going to adapt as a human species. We are going to evolve the technology. It will have some bad effects, like every technology does, because that is human nature. but largely it will turn out to be something good. And if we move with that attitude, I think we will be successful at this. As humans, we've been successful at pretty much everything in past centuries, which has made us successful as a species.
I think you answered my last question, Imran, which was what excites you most about the future? And I think you've just answered it. So I thank you. This is great. I really appreciate your insights and everything you're doing at b.well. Our listeners are welcome to check them out. It's b.well, W-E-L-L. And we want to thank you for taking time out of your busy schedule to join us and share your thoughts and insights. I'm going to hand it over to Amit to close us out.
I think this has been a very insightful talk. And one very important thing that I had learned from Imran's conversation is it's health AI more than healthcare AI. I think that's a good tagline. And I look at this also from another point of view, and I would like to share it with you guys here that, both of you were quite right when we say that, the application of AI in health or healthcare, as we call it, it's going to be different in different region. The need gap in a developed country will be completely different than in a developing country. There's going to be leapfrog steps being taken in some spaces. I see that happening in India. India adopted to UPI payments in a leapfrog way. We shifted to mobile gateways of payment. I'm sure we're doing that. We're going to do that something with AI coming in as well. In the field of medicine, I look at this from a little different point of view. When we say AI in healthcare, all good with patients getting the support, the logistics and the automation being taken care of, all that's good. Medicine will get affected or will get influenced when we really see a lot of AI medical reasoning coming in the clinical decision support system. I think that's where the decision-making abilities of a clinician is going to evolve, whether for good or bad, whether it's going to impact the cognition and increase the cognition depth and all those kind of things, which is recently getting published, is a complete different kind of a point to debate on altogether. But I really see that getting impacted. So a quick word, Imran, we are seeing this is the era of agents coming in. And one side you have the agentic AI coming in, one side you have the chain of thought reasoning coming in. And some people argue that it's possibly not a chain of thought reasoning that mimics a human pattern, it's more of an illusion. Yeah. So if you see that, amalgamating a COT with agentic AI coming in medical reasoning, somewhere put into the clinical decision support system, how do you really see that come in, and how do you see medicine evolving with it? I'm really very excited to see that space coming in. And your thoughts?
Yeah, I think that's a good. So the way I'd explain it is, think about your car. So when you press the accelerator in our car, do you understand all that happens in your car to move forward? And unless you are a car junkie, I think the answer is no, because there's all kinds of complicated stuff happening in your car. Yes. But you don't care, because you know that when you press the accelerator, the car always goes faster. When you press the brake, the car always stops. So you have a simpler mental model of how your car works, right? You don't understand all the details of it works, but because your model fits what you see in the real world, you are okay with that simple model. And as humans, we do this all the time.
Absolutely.
Right? We do not understand. So I think that is part of us, instead of us saying, let's train doctors to understand AI completely and become data scientists and understand how features work and parameters work, I think that is kind of not useful. I think we have to create these simple models that we can understand and we can validate that they always work in healthcare. And that is also true even outside of AI. Like, if you go ask a lot of the doctors, unless you are a specialist in an area or a researcher in the area, you probably don't know the full mechanics of that thing. Like when you're told how GLP-1 works, I don't know if most doctors know the full mechanics, nor do they need to. Right? They just need to know that a GLP works at a high level in this way, and you apply it in these cases, and you don't apply it in that cases. So I think your chain of thought reasoning and understanding that, to me, I think it's really getting to the point where the expectations that healthcare workers meet what they see in reality when AI is deployed. And that's all that's needed. Once they see it happen, then they trust belief. I think agents are really, really interesting, right? Because I think so far we've thought about AI largely as telling us what to do, right? So we go ask it, okay, should I do this or that? And AI can say, okay, based on the wisdom of all of these experts, here's the answer. I think AI agents is probably the first thing where actually technology is surpassing the boundaries of the screen. So most technology, if you look at your EMR, you look at this, they really just get limited at the screen. Their goal is to show something to someone largely, right? And there's e-prescribe and stuff, but generally that's the case, right? What AI agents are really doing are saying the boundary of technology does not stop at the screen. The agents can actually go do things for you. So like at b.well, we're having agents go out and make appointments for you, right? Agents can go out and get lab tests for you. Agents can do these kind of things. That I think is a fundamental thing that we really haven't had in technology before, to be able to break the barrier of the screen. And I think that will be really, really important. And the last thing on AI agents, I'll add, I think we would agree that a single system cannot solve all problems, whether in healthcare or anywhere else, right? It's just not possible, because what happens is the system gets so complex that it becomes unmanageable when it's trying to do too many things. Right? Same as like you can't have a doctor that's a specialist in all specialties, right? It just doesn't work, because then it's too complex. And so I think what AI agents are really enabling us to do is saying, let's break this problem into different problems and have agents that are responsible for different problems. Just like in healthcare, we have specialists responsible for different problems, and then pull all that together as a care team to get the answer. And that is more likely to succeed than to say there is one AI that is going to solve everything in healthcare, because we've learned for a long time that model really doesn't work anywhere, because those systems get more complex and hard to understand. We need systems that are very focused on different tasks, and then have sort of like a care team pull all that together. And AI agents enable us to do that. So at b.well, we're really building everything as agents and not as a monolithic one AI system. And we believe that I think it's going to be the marrying of the different agents that different companies are creating together into a care team. Just think about, as a doctor, when you're putting together a care team, you don't just get doctors from your health system. You find a PT that's over there that's really good, and you find another clinic over there that specializes in this, and you put together that care team to treat the patient.
Yes.
I think we have to think about agents the same way. It's like, let's have agents from different companies put together to create the care team.
Yeah, I totally echo with that thought, and I think that's the space that possibly will change the way, as a healthcare provider, as a doctor in the front line, we will be possibly looking at medicine from a different lens or a different viewpoint with agents in space. So that's one space to look out for. But a one-liner that if I would like to add to this is, the medical community always looks for evidence. They look for a structured flow of thought and a structured flow of reasoning going behind any clinical decision being taken, just the way we have been taught in the medical days to think like. We would possibly want our agents to think like that as well, and kind of sync with that viewpoint. So this is a very interesting space, Imran, that we would love to see how clinician's medical mind will evolve with artificial intelligence. I think that's the space that we would love to see heading into. And as we keep saying in DoctorsAI, that we believe in strongly that it starts with the curiosity. It starts with being ready to adapt and being ready to adopt to this particular change, and it's all that starts with this literacy. So we strongly believe in creating the right literacy of digital health and intelligence in the community. So Imran, thank you so much. It's been a fantastic session and engaging discussion with Dipu. We love the conversation, and I was speaking to some of my colleagues in the community while this podcast was on, and I received from some fantastic feedbacks about this session. Thank you so much for joining us. And to all our viewers out there, stay connected with us. We come with this podcast once every month, but we have so many activities in the Doctors AI community. We come up with the update hour. There is a journal club where we keep on discussing new researches that has come up. And now, of course, in November, we're coming up with the Doctors AI Global here in India, which is going to be a 2 days of dedicated conference. It's an invite to all of you who are connected with us. Be a part of the summit, because for the first time in India, this is going to be an AI summit by the doctors, for the doctors, with the collaborators from the technology. Be curious to learn, be curious to adopt this powerful new technology. Thank you so much, everyone, for joining us. Once again, thank you, MedSynapse, for hosting us. Till we meet again next month is goodbye and good night, everyone. Thank you.
Thank you.
Bye.